Hi guys, my name is Paige Stinson. This is Anna. She's my client. She is a 21-year-old dancer and she has knee valgus that she's coming in to be treated for. We are going to try and condition her and strengthen her and hopefully increase her range of motion so that she can get back to regular functional tasks as well as get back to dancing out on the floor. We'll be using an overhead squat assessment to assess her knee valgus, which will be seen in the anterior, lateral, and the posterior side of things. And then, so feet shoulder width apart. You're going to place your hands over your head and then squat as far as you can go. Don't go past 90. Awesome. Okay, so the overhead squat assessment is typically used to assess dynamic flexibility, core strength, balance, as well as overall neuromuscular control. She is pretty young, so she has pretty good balance and core flexibility, but we are assessing lower extremity just because she does have knee valgus, which we could see in the video. Valgus is typically seen by the underactive muscles of the glute med, as well as the glute max and the hip flexor complex, so the iliopsoas muscle. And then we'll also see in the overactive muscles with the adductor complex, so the adductor magnus, the adductor longus, and the adductor brevis, as well as restricted dorsiflexion from a tight anterior tib and a weak posterior tibialis. The cause of our findings, basically the whole body is connected through the kinetic chain, so essentially she does have knee valgus, but a lot of these things can stem from foot issues, so any weakness around the ankle joint as well as the muscles in the lower leg. Again, foot restrictions, an overactive anterior tibialis and an underactive posterior tibialis can cause tightness in the front and then also weakness in the back. So we want to essentially reduce the amount of retroversion in the foot, which would cause knee valgus, and then as well as any hip complex imbalances that would come with the knee imbalances. So the first thing we're going to do is go through an inhibitory technique, which would be a self-myofascial release. My client is going to foam roll her glute med, as well as her abductor complex and her glute max. I'll also be putting her through some calf foam rolling. And then most importantly, we're going to do the adductors because those are what's overactive and what's the most tight, as well as the anterior tibialis. Right now she's rolling out the underactive. Typically trauma is in the adhesions of the tissues, which creates inflammation in the body, stimulating the pain receptors to go off, which would cause a protection of the muscles and then essentially creating muscle tensions and muscle spasms. So with self-myofascial release, we want to inhibit the overactive fibers. So go ahead and start doing your adductor complex, because those are the ones that are super tight, as well if you want to hit the anterior tibialis, do those too. As we go through myofascial releases, the microspasms and the breaks in the fascia adhesions will start to break up as long as we're hitting trigger points for only 30 seconds to maybe 1 minute, depending on the severity of the adhesions. Breaking up these trigger points of the overactive muscles will decrease and inhibit the muscles of the gamma loop activity, essentially reducing pain and inflammation in the muscle. Next, we're going to go through a lengthening technique. We can go through static standing adductor stretch, static piriformis stretch, static gastroc stretch, but we're going to take her through the static kneeling hip flexor stretch. So she's going to go into a slight lunge, and then she's going to place her hands over her head, lean into the stretch a little bit, and lean to that left side. Typically, she's going to hold this for 30 seconds to properly decrease the muscle spindle activity and motor neuron excitability. If she was an older patient, we would do it for 60 seconds. Static stretching typically stimulates autogenic inhibition by combining minimal force for longer durations, which would also help, after the myofascial release, increase extended range of motion. Next, for our third technique, we're going to do an isolated strengthening technique. So go ahead and grab that chair. We're going to work on that posterior tibialis because it is weak, including her inversion. So we want to strengthen those basically by isolating the muscles to increase strength and force production. This is typically done in the underactive muscles. This is why we're doing the posterior tib instead of the anterior tib. We want to release the anterior tib and the adductor complex with the myofascial release, and we want to strengthen the inverters and the plantar flexors, essentially with the posterior tibialis. By doing this, we can increase motor unit activation and recruitment, as well as motor unit communication and the frequency of firing. So I'm just gonna hold her leg, and then I'm gonna apply some restriction, and then she's going to plantar flex as well as evert her foot, just like that. She's gonna hold 1, 2, and as she comes back on her eccentric, she's gonna hold 1, 2, 3, 4, just like that. Go ahead and go again. Typically we'll do this 3 to 5 days per week, 1 to 2 sets, 10 to 15 reps. Again, she's holding 2 seconds at the isometric range, and then 4 seconds on the progression of the eccentric rep. The posterior tibialis we would do for knee stability. Another thing we could do for the hip would be like a standing glute max, or wall sides again for the abductors, as well as the medial gastroc, because all of those muscles, gastroc, glute max, all the abductor complexes and the hip complex are typically going to be weak, and we want to strengthen those muscles so that we can activate those muscles and creating better balance of the weaker side. Thank you. And then lastly, we're going to do a dynamic integrated movement. So she's going to put this band around her ankles and do a lateral walking. Yep, just like that. She's going to go about maybe 45 degrees down, shoulder width apart. And then you're just going to make sure that back foot doesn't go past under that hip. Stay shoulder width apart, perfect. And we should feel this firing in the glute med and all of our abductors. This improves and enhances functional movement by working on postural and muscular capabilities through multiple planes. Because functional movement often requires multi-joint and intramuscular coordination, dynamic integrated movements can typically help increase muscular coordination and reprogram the neuromuscular system. We would do the dynamic integrated movements for about 3 to 5 days, 1 to 3 sets, 10 to 15 reps. And then we want to see them doing this slowed and controlled because we want to increase the neuromuscular connection. And again, I had her do the lateral tube walking, but the hop stabilization with the inner and outer leg would also be a very good exercise to do to help with dynamic integrated movement. Thank you.